Hello, today we will be discussing 4 conditions of the thorax. The first condition is pneumothorax. There are 3 classifications for pneumothorax: spontaneous, traumatic, and tensive. Spontaneous occurs without any obvious injury. Primary occurs in the healthy, while secondary occurs in those with underlying lung disease. Traumatic occurs when there is a blunt chest injury due to a fractured bone or medical procedure. Tensive occurs when a respiratory injury allows air entry but does not allow exit. Symptoms include dyspnea and asymmetrical chest expansion. Traumatic causes hypoxemia, while tensive causes increased intrathoracic pressure. Diagnosis for pneumothorax is made through tests such as chest radiographs and CT scans. Small and spontaneous is treated through important lifestyle changes, while large is treated through air removal, and traumatic is treated through continuous chest suction. Nursing interventions include assessing chest expansion, maintaining chest tube drainage, and monitoring vital signs. Next, we will be discussing the condition hemothorax. This occurs when there is blood in the pleural cavity. This can be caused by an injury which causes trauma or any disruption to the chest wall tissue which creates a counter pressure on the lungs. A minimal hemothorax is 300 to 500 milliliters of blood, while a moderate is 500 to 1,000, and a massive is over 1,500 milliliters of blood. Signs of hemothorax include increased heart rate, chest pain, dyspnea, and asymmetrical chest expansion. Diagnosis can be done through a chest radiograph, ultrasound, and CT scan. Treatment includes tube thoracostomy to drain the blood, video-assisted thoracoscopic surgery, and a thoracotomy to remove the scarred and fibrous tissue. Nursing interventions include documenting the rate and amount of draining blood while also assessing vital signs and administering antibiotics. Now we will be discussing chylothorax. A chylothorax occurs when there is a collection of chyle in the pleural space. This can be caused by a surgery, tumor, or any sort of trauma that causes damage to the thoracic duct. Some symptoms include immunosuppression, which can cause infection, electrolyte imbalance, which can affect diffusion gradients, chest asymmetry, and hypovolemia. Diagnosis includes pleural fluid analysis using either a pleural tap or thoracentesis to assess the fluid in the pleura. The main course of treatment is to immediately drain the fluid from the pleural cavity. Nursing interventions include preventing malnutrition through total parenteral nutrition and reducing the amount of fatty acid intake. It also includes providing medications such as octreotide, which decreases intestinal motility. Lastly, we will be discussing the condition empyema. Empyema is a collection of pus, fluid, and cellular debris that builds up in the pleural space. It can be caused by bacterial pneumonia, a rupture of a tumorigenic mass into the space, or infection due to trauma or surgery. There are 3 stages of empyema. First is the simple stage, which is the basic collection of fluid in the pleural space. Then is the complicated stage, where there is thickening of this fluid to form pockets. And finally, there is the frank stage, which is the fibrosis and scarring of the lungs. Some signs and symptoms include persistent pneumonia, dyspnea and chest pain, crackling chest sounds, fluid and scar tissue buildup in the lungs, and fever and pus production due to the infection. Empyema is diagnosed using chest x-rays, ultrasounds when x-rays are inconclusive, and CT scans. Treatment is focused on the use of antibiotics to treat the infection and drainage of the fluid from the pleural cavity. Surgery may also be required in some severe cases in combination with fibrinolytic therapy. Primary nursing interventions are to consistently evaluate level of consciousness, use precautions for infection control, record amount of fluid drainage from the chest tube, and constantly assess breath sounds. I hope you enjoyed this video discussing the conditions pneumothorax, hemothorax, chylothorax, and empyema. Thank you for watching.